Welcome to State of the State. As our celebration of Mental Health Month continues, we're here today to talk with two of our state legislators about the current challenges and legislative efforts underway to address the state's youth mental health crisis. I'm Susan Orban, Director of the Washington County Coalition for Children, a regional child advocacy organization in southern Rhode Island, and it is my privilege to be your host. We're pleased to have two members of the South County Caucus with us today. Senator Alana DiMario, representing Senate District 36, serving Narragansett, North Kingstown, and Block Island since 2020, and Representative Teresa Tanzi, representing House District 34, serving residents of Narragansett, Peacedale, and Wakefield since 2010. Both legislators bring both experience and passion to the issue of youth mental health. Senator DiMario is a licensed mental health clinician with a specialty working with children and families, and is on the front lines of children's mental health. Last year, Rep. Tanzi was recognized as Legislator of the Year by the Mental Health Association of Rhode Island for her work trying to pass parity legislation and increase access to behavioral health care in Rhode Island, as well as her engagement and advocacy with Healthy Bodies, Healthy Minds, Washington County, her area's health equity zone. We're honored to have both of you here today. Welcome. And thank you so much for making the time to be here during this very busy legislative session, time of year. So before we start talking about legislative action, I'd like to focus on leadership. Currently in Rhode Island, no one state agency is responsible for overseeing youth behavioral health. It's a whole list of acronyms. It's EOHHS, Executive Office of Health and Human Services, DCYF, the Department of Children, Youth and Families, DOH, the Department of Health, BHDDH, the Behavioral Health, Developmental Disabilities and Hospital Agency.
It's a mouthful.
Yes! RIDE, the Rhode Island Department of Education, and OHIC, the Office of Health Insurance Commissioner. They all have roles in this very complicated issue impacting our children. And this long-standing structural lack of leadership and vision in state government is really playing a critical role in our crisis right now. Is this problem widely understood in the legislature? And what can be done to fix this vacuum of leadership in our state?
I think the fact that we have so many actings, not only do we have a large number of organizations that oversee the programs that impact the lives of our children, we also have a lot of sitting or people who are not approved by the Senate. Yeah. So we've got acting directors in many of these agencies. It is a problem. Not only do we have not one single group that oversees children exclusively, we really do lack leadership, as you had said, at the very tops of those organizations.
Mm. And I think that there's also difficulty when you look at the nature of mental health needs with children, and the fact that all of those different acronyms represent different settings that a child could be in. So a child might need extra support in schools, a child might need extra support in their family situation, through DCYF. A child might be placed in an out-of-home placement and then would kind of transition into another system of care. So I think that there does need to be a balance between having that recognition that there are those different settings and systems of care that a child likely will interact with if they have needs, but that there needs to be some continuity running in between those systems. And I don't necessarily know that that continuity needs to be that they all fall under the same person at the very top, or if it just needs to be a better system of coordination. And I do think that an aspect of that comes back to the fact that all of those different acronyms that you mentioned all have their own separate budgets as well. And so when you're thinking about that transition, you know, sometimes those lines are not very clear. And I think that especially when it comes to children, there needs to be more recognition and allowance of the fluidity of moving between those systems and the dollars that kind of need to flow with that.
No question about it. And speaking of dollars, let's face it, our healthcare and behavioral health care are really driven by our insurance coverage. Mm-hmm. And historically, insurance plans have not covered services as well for behavioral health conditions as they have for physical health conditions. And that has meant that some insurance plans don't cover some services at all. Some have higher copays for office visits with behavioral health clinicians. Some have limits of how many visits one can have in a year, and that really impacts the care that people receive. And yet, in 2007, federal law was passed that required insurance plans to cover mental health conditions in the same way that they cover physical health conditions. And that law, it refers to something called parity. And parity impacts access to mental health care both on the side of patients, like I just talked about, as well as providers.
Yes.
And insurers underpay providers, mm-hmm. and then those providers leave Rhode Island, and then patients have to pay for out-of-network providers because they can't find an in-network provider, or wait a really long time for services.
Right.
And this has been true for decades. So I know this is an issue that is near and dear to both of your hearts as a provider, mm-hmm. and as someone who's been fighting for parity for a number of years. What can you talk about? Tell us, what's your sense of parity legislation passing?
Yeah, I think while you were describing the situation, you know, my mind went to how lucky those individuals are who can even see a provider, who can even find one. You know, regardless of whether they can pay out of pocket or whether their insurance covers it. The real barrier right now is finding someone who's open to taking a new client or a new patient on. The system is clogged. I mean, there's, you know, you can use whatever analogy you want, a log jam, but in all honesty, you know, whether you're higher acuity at the very top of the level where you're needing hospitalization, right down to, you know, a child who's in crisis at school on any given day, you know, there's just not an opening, and you've laid out the problem very clearly, right? We've got other specialties that are making significantly more in the state of Rhode Island than those who provide mental health and behavioral health. So I've got a piece of legislation in that's called mental health parity, you know, that's what we refer to it as, that would bring those providers up to the same level that other specialties get. And again, this is a federal law that was passed. This was something that was passed in the state of Rhode Island as well. We've got, you know, Patrick Kennedy, who's been a champion for all of these issues, both in Congress and in our state. And, you know, it's unfortunate that our state has to make a new law so that we actually comply with an old law. But that's where we stand now. We need to make up that 24% difference somewhere. So if I were a behavioral health care provider newly graduating, I'd find it very hard to want to set up a shop in Rhode Island, no matter how much I love the state. You know, I would consider moving elsewhere, because how are you going to pay those costs of your college that you've just, you know, put on yourself? It's a conundrum, and I think the only way that, not the only way, because there are obviously many ways, and we've got a number of different tools in our pocket, but I think it's a good faith effort to start to raise those reimbursement rates. And the bill that I've got in right now with Senator Pam Lauria also has a 5% this year rate increase. So fingers crossed. But, you know, again, that isn't the only answer.
Yeah, and I think it is, you referenced this, that there are, kind of some other tools at our disposal, and I think part of it is the retention strategy of making sure that for people who are working in the field that we are paying them adequate rates. And then I think there's also the recruitment and the workforce pipeline strategy, because like with so many other industries in Rhode Island, our mental health workforce, social workers, especially outpatient therapists, are kind of an aging workforce. And so thinking about how are we building that pipeline? And so investigating different avenues, like making sure that our programs to educate these future professionals are affordable and attainable, more so than they are now, helping potentially with student loan repayment, especially in areas of most need, I think is another tool that we could use. But also, again, specifically when you're talking about providers that work with children, recognizing and having our reimbursement models recognize that when you're treating a child, by nature you're going to be doing more work. You have more phone calls, you have more coordination, and it is very difficult sometimes to recapture that time in a way that is reimbursable under our current structures. And I think that we need to do a better job of recognizing that that is something that also deters that workforce from choosing to work with kids.
I know part of the issue with reimbursement rates has been around the low Medicaid rates that we have in our state. And there's a lot of hope riding on the OHIC study and that being the key to raising rates. And yet many people rely on private insurance, and those rates related to private insurance have to raise also. Right. And so I don't know what your sense of the speed at which the OHIC study will shed light on the issue and how soon those Medicaid rates can be adjusted, yes,
accordingly, right? Well, we've had many studies that have sat on the shelf long after we've completed them. This one, from my understanding, is going to be another 1.5 years before we can begin to see implementation.
And I think, part of the key of really capturing what true costs and true value are is also looking at what is the cost when we don't have an adequately staffed and resourced continuum of care. So, being able to capture, when we're talking about raising Medicaid reimbursement rates, what happens when there isn't an adequate network of outpatient professionals, and then people in need end up utilizing emergency services or end up in inpatient services where that could have been avoided, and that can be a more difficult thing to capture. But I think specifically to your question about Medicaid versus commercial insurance, the model that I think people are kind of basing this idea on is that the Medicaid rates would be kind of the floor, and then the commercial insurance reimbursement rates would kind of have to go upwards to match or potentially surpass that to kind of keep pace with with what we see in other sectors. So, but yeah, I know we're a little bit of a ways out from that, and I do know that there's an effort currently in the General Assembly. I know it's Senator DePalma on my side, and I believe it's Representative Casimiro in the House, who are looking to make sure that we have some bridge funding to try to keep some of the kind of COVID pay bumps going while we're waiting for that rate reform study to be complete.
Yeah. Right. I know that many providers of behavioral health services are really desperate for that
lifeline.
Yes.
Yeah.
To see them through until those reimbursement rates come through. And it's been such a long time since those rates have risen in our state, and we just have not kept pace with other states.
And there's a reprocurement process that's going on right now as well. So, combined with the OHIC study for rate reform, we've got an opportunity to really transform the system. The issue comes around whether or not the state will fund it, and whether we're ready to make that commitment to a vibrant and fully formed system that isn't log-jammed, right? And it's going to take many different approaches, but we have a wonderful opportunity ahead of us. I hope we take it.
Yes, I certainly hope so. One of the factors that comes into play is the state's reliance on short-term federal grants. and to fund a lot of specific programs that help families, from home visiting to 988 and the crisis hotline. And many of those grants are time limited, and once they're gone, or they're focused on a particular part of the state, because to compete nationally to get the federal grant, they focus on the area that may have the greatest need, and so the rest of the state doesn't benefit from that particular grant. So what can be done to provide more reliable sources of funding for children's mental health in our state?
It is a vicious process of us chasing those grants.
Yeah, and I think the grant thing is tricky. I can, speaking to it from the provider perspective for a minute, practicing in Rhode Island for the last more than a decade, I have been involved in working in outpatient settings where, we are reliant on grant funding. And with those grants come certain parameters of practicing under a certain model. And like you said, treating a certain population in a certain place. And while those types of grants can be wonderful as kind of an incubator to figure out, like, what is something that could really take root here that we might want to find sustainable funding for or figure that out, because we're so reliant on it, it ends up in being kind of a patchwork and inconsistent type of system where providers are trained in a model, we use that model for a while, the grant funding runs out, it never really got its feet underneath it, and now we're kind of transitioning to another grant, and that doesn't really help the communities we're trying to service. It doesn't help us build a good, solid continuum of care. I think in an ideal situation, we would have a solid continuum of care where then we could use those grant dollars to be able to find, a specific model that we might want to adopt and kind of spread throughout the state, and find how to integrate it, and not as kind of the pillars of the things that we're doing. On the other hand, we recently have been engaged in a grant where we've gotten federal dollars for the last 5 years to be able to run the PRN and Moms PRN psychiatric referral networks, which has been an unbelievably helpful model in helping kids, and especially postpartum women, be able to access psychiatric care through their pediatrician or primary care provider, who is then kind of backed up by a network of psychiatrists who can provide consultation for those frontline prescriptions. And so we've had this grant for the last 5 years, and actually right now we're kind of on the edge of being able to find a sustainable funding model by just having a small assessment on commercial insurance policies. And so the return on investment there is huge for a very small amount of money, and it's actually not even going to be coming from taxpayer money or the state budget. So finding those opportunities through those grants that we can actually make something sustainable and find that sustainable revenue doesn't always happen, but when it can be really useful.
I think at the end of the day, back to your first point, is we need a vision.
Yes.
And we need a plan, and we need to not be, like a dog chasing after, a car. We need to have an overarching idea of where we want to take our state. And then if a grant can help fill that, that's a wonderful thing, but not be driven exclusively by that. And I have the feeling that we're like a boat without a rudder out there, just chasing after whatever grant we can. And that's no way to maintain a system.
Mm-hmm. Absolutely. So you've both been involved in introducing and supporting legislation related to mental health this session. And so what pieces of legislation excite you the most?
I'll let you start.
Sure. So this goes back to the workforce development piece and also the solvency of our community mental health agencies. But one thing that I'm really excited about is the opportunity to start allowing for Medicaid reimbursement for mental health intern services. So we currently have mental health interns in a lot of our community-based mental health organizations throughout the state. Currently, the people who are overseeing that work, the supervisors, that's kind of lost time for them. They don't get to be reimbursed for that, and any other way. And also for the interns, they're not making any money, but they're servicing people who otherwise need help. And so by just making this very small switch and allowing for that reimbursement, we can open up the pipeline a little bit for opportunities for more interns to be able to be taken on into our community mental health centers, and also help with the community mental health centers bottom line while they're helping us to build up this essential workforce. So I'm really hopeful for that one.
That's great.
Yeah.
Yeah, for me, there is one that I'm a sponsor of that is paying for school meals for children. And during the pandemic, we had 2 wonderful years where, regardless of your ability to pay, you entered school and you could get a grab-and-go breakfast, and you could get lunch without any issue whatsoever. And that ended abruptly this September. And now we have a desire to make that permanent. I think you speak to any teacher, and they will say that a well-fed student is one who is there to learn and who is capable of learning. I equated it when we had our hearing in the House to, buying a very fancy car and doing all the planning you needed, getting your license, getting your insurance, and then purchasing, saving to purchase this wonderful car, and then not being able to afford the fuel to put in the car. And, the car just doesn't work, So we've got the wonderful investment of our teachers, of programs, of buildings that we've really made a push for in our state. And yet, we fail to provide the simplest building block that we all know is important. As adults, we know this as well, that we need fuel to be able to run an efficient, body and brain. This is one of those things that I just can't understand why we don't fund it. We provide the building, the books, the transportation, all of those things, and how we overlooked food is I think something that we just need to kind of recognize that as being a fundamental flaw in our education system currently, and make way for that. Of course, all of these ideas have, they need approval from the General Assembly. And when you've got 2,000 bills in front of you, I think actually it was only 1,000 or 2,000 in the House. It was more bills than ever before. Yes. It's hard to pick and choose which ones get the full attention. I also would love to see the ratio of social workers to students bill pass. Whip Kazarian has that on our side.
Senator Sosnowski has it on mine. Yep.
Yeah, and so there are many school systems that don't have maybe a ratio of 1 to 1,000. Can you imagine being the one social worker who has to go to 3 different schools and try to understand the needs of those children? So her bill would be for 1 to 250 ratio of
which is the national standard.
Yes. Which is the national standard. Yep, it's not a number that was just picked out. And that would be wonderful to be able to support those children who are well fed in well-built schools with highly educated teachers. That would be lovely.
It would indeed.
And I have to say, just kind of building off of what Representative Tanzi was saying, especially about the school meals, is that when we're talking about supporting mental health needs, especially for children, we have to pay attention to those environmental factors. There's no amount of good counseling in the world that can overcome the level of stress that is experienced by a child who is housing insecure, who is living in a difficult situation, where their parents are not well supported for their own mental health needs, who goes to school with an empty stomach. You can't overcome that with therapy or mental health services. And so looking at those foundational needs is also essential to improving the quality of our children's mental health in Rhode Island.
No question about it. So, in what other ways is the General Assembly working this session to improve youth mental health?
I think all of these, different bills that we have are getting at that. I mean, it's a bigger topic than it's been before, and that's great.
That's great.
It's unfortunate, though, that it's because we're experiencing such difficulties. Even if we didn't have the pandemic inserted in the middle of all of this, our state was still on a path for, for running into issues. We've not been funding things in an appropriate manner. We've been relying too much on the federal grants. Every opportunity we get to supplant a general fund dollar, a Rhode Island dollar, with a federal dollar is taken. And I think that is short-sighted when it comes to maintaining a network. I was elected 13 years ago, and we had a wonderful system 15 years ago. I think many people look to us as leaders. And so much has changed because we have, little by little, just let the money, go elsewhere and changed our priorities. And you can't, even when you have that lovely Porsche in your driveway and you can afford the gas in it, you still need to maintain it. You still need to make sure that you rotate do all of the maintenance things on it. And I think too often we fix something, and then we think it'll just glide, and then we take a little bit off of it one year because we're a budget shortfall. We'll take a little bit more off it the next year. And we're running on a 2-year budget cycle and a 2-year election cycle.
And that really gets in the way of having any kind of long-term vision.
Yeah.
And plan and implement it.
For sure. I would say, I think the other thing that we're working to move forward is making sure that we have the resources we need to truly build out our 988 response system. And going to the point you made earlier about making sure that those resources are available statewide in the form of not just somebody who's available to respond in the moment, but potentially building out our mobile crisis teams, being able to connect them with the certified community behavioral health centers that we're going to start standing up. One of my biggest concerns about that, and something that we've been in conversations with, is also just making sure that we are appropriately building in the needs of children into those services, because that looks very different than what adults in our community need. And so just making sure that that those voices are being heard as we're setting those systems up.
No question about it. It's one of my concerns too. And 988 is really designed to not only provide some place for someone to call, but also someone to respond through mobile crisis. And then for children, having emergency stabilization services available to them. And so it's so much more than just a hotline. And the federal legislation allows for a fee to be placed on cell phones, like the fee for 911, to help support that. And other states in the nation are moving to do that. And I hope that our state will do that too. So as we begin to wrap up our session here today, I guess I'm really curious about what you can tell us about how we can support you in your fights at the State House, and what we can do to make sure that these bills pass, and how we can be involved and supportive.
Yeah, May is Mental Health Month, and it's also as we begin to write our budget. So I think it's critical that people, whether they've spoken to them 1,000 times about these issues or never once picked up the phone or sent an email, to do so. There is a lot of competition for our attention right now. Again, over 1,000 bills, and we really need to make sure that we get our voices heard. So don't hesitate to call them again, and share your voice, and your experience, right? It's not just what it's not just about the technical nature of the bill or the funding specifically. It's having an understanding of how these changes impact the lives of those we represent. So, if you're willing and able, share your story.
Yep, completely agree. Could not have said it better.
Okay, so I hope you're listening and that you're going to let your voice be heard. And so that really wraps up our time together. I am so grateful that you both made the time to come here and be with us. I guess what I would like to leave those of you watching with are two things. One is that if you're concerned about a child and need some advice, I would urge you to contact KidsLink. for triage and help with referral, and you can reach them at 1-800-855-543-5465. And if you or someone you know needs to connect with a crisis counselor for emotional support, services are available 24/7 by calling 988, just like you call 911. And that's it for our show today. Thank you so much for joining us.